Healthcare is a human right for all, and although a lot's been done to help uninsured and underinsured patients to receive the care that they need over the years, there's a lot that could be done to remove some of the health disparities within our United States healthcare system. One topic that's been in the news lately has been Medicaid. So, what is Medicaid? Medicaid is a federal service that's provided through tax dollars, and it provides health coverage to millions of Americans. In order to apply for Medicaid, you have to apply annually and prove that you are either underneath a certain income threshold or that you have a disability. What goes hand in hand with Medicaid is a system called CHIP, which provides insurance to children and families that have an income that is slightly above that threshold that would make them eligible for Medicaid services. Now, nearly a quarter of Americans that are insured are covered under one of these two services. According to 2021 statistics on healthcare coverage in the United States that was released in February of 2023 by the Congressional Research Service, it states that around 299 million Americans, which is about 91.4%, are covered under some sort of insurance. Now, most of these Americans are covered under private insurance, which is either paid for out of pocket or provided to them through their jobs. About 60 million Americans are covered under Medicare services, which is about 18.2% of insured Americans. Medicare is for people over the age of 65, and similarly to Medicaid, it's covered by the federal government. Now, comparatively, 69 million people are covered under either Medicaid or CHIP services. That's about 21.2% of insured Americans. To reiterate, Medicaid is for people with either disabilities or underneath a certain income threshold, and CHIP is for children and families that have a little bit above that income. That's nearly a quarter of the population that's insured in America are covered under these two services. 69 million people is a lot of people. And about 15 million of these people are about to lose their Medicaid services. According to an article by Irina Ivanova, which was published in March 31st of 2023 through the CBS Interactive Incorporated, it was titled "Millions of Americans Are About to Lose Medicaid Coverage. Here's what to know." It states that since April 1st, states have been removing Medicaid coverage for many patients. So before the pandemic, people would lose their Medicaid all the time on the basis of they're making too much money, or they move to a different state, or they gain a different insurance through their jobs. But since COVID, around 2020, many states enforced continuous renewal provisions during COVID, which stopped the procedure from removing people from Medicaid. So people just kept on retaining their Medicaid over the years, and they didn't have to fill out a form to prove their eligibility during COVID. And between 2020 and 2022, 5 million more people were included in Medicaid services. Now, a projected 15 million people are about to lose the services because we're going back to the way it was. That's nearly 1/6 of the people who currently have Medicaid are about to lose it. Many are likely to drop out of the program because they're not going to fill out the form that proves their eligibility based on income or their disability. Some states have already begun removing Medicaid. According to this map, it shows the different months, and it started this month in April. And our state of Connecticut is going to start in May, which is next month. Many people, as we speak, are losing Medicaid coverage. States also aren't doing a very good job at letting people know. As of last December, a survey was taken and 2/3 of adults didn't even know that this was happening, that this change was being implemented. In order to make people aware of this change, states have been sending people mail to their homes, and on top of it, they're making calls and text messages to inform them to fill out this slip that shows their eligibility to the state, and they have 30 days to do so. That's what the letter states. But many people aren't receiving this message, and that's going to cause a lot of issues for a lot of families. Now, between March 31st and July 31st, there's a window for people who lost Medicaid to apply to a different plan. But a lot of these plans that are employer sponsored have co-payments or out-of-pocket costs that were much higher than Medicaid. And for a lot of families, this is undoable. On top of it, they also, in a lot of cases, have to find doctors that approve these plans, which is a big hassle in itself. Now, a lot of options have been thrown around during the years to improve the United States healthcare system and decrease some of these health disparities and problems. One of which that's gained popularity throughout the years is a single-payer system. According to Dr. Andrea Christopher's 2016 article titled Single Payer Healthcare, Pluses, Minuses, and What It Means for You, which is posted to Harvard's health blog, taxpayer systems could work to reduce some of the health disparities. In this system, according to this chart right here, many people with private insurance currently pay monthly premiums to these insurance companies, which pay for the treatments of procedures and medications. We pay a co-payment at the office as soon as we go in for our regular checkups. But under a single payer system, instead of having a million different insurance companies and a lot of differences and complexities, everyone would pay a little bit more in taxes to the federal government, who would pay for our treatments. We would still pay a co-payment, but in this single payer system, everyone would have the exact same insurance. It's often referred to as Medicare for all, because everyone will have a plan very similar to what's already in Medicare. It would just be opened up to people of all ages, regardless of whether they're above 65 years of age like it currently is. Under the system, everyone would have the same insurance and would be able to choose their providers that they want. The prices of medications and procedures would also dramatically decrease because the government can bargain down some of the prices and also set prices to medications and procedures. In addition, many other countries have already utilized this system and have had great success. Actually, 56% of providers are actually for this system. And in many ways, it would fix a lot of the health disparities within our United States healthcare system. Now, healthcare should ultimately be viewed as a right rather than a privilege. It's important that we do this and that we recognize some of the health disparities within our healthcare system and try and eradicate them in many ways, brainstorm ideas to get rid of them. Although nearly a quarter of Americans are covered under Medicaid or CHIP services, these people are subjected to discrimination in many cases. A projected 15 million people who currently have Medicaid services are about to lose them. And one option that's gained popularity through the years that would fix this problem and many others is this single-payer system. There's many different benefits to the system. Recognizing issues and exploring options is the first step to change. And my hope is that the people who are currently covered under Medicaid services are taken into consideration and have a voice in the changes that we make. We should work to make sure that those with disabilities or those underneath a certain income threshold are able to receive the care that they need, because ultimately, health is a right.